Tonight, the Rhode Island Department of Health is reporting 110 new COVID-19 cases, but no new deaths.
The daily positivity rate totaled 2.5%, which is up slightly from the day before.
77 people remain hospitalized tonight, which is the most since June 27th. Today's number includes 13 people in intensive care and 5 on ventilators.
Lifespan's chief of emergency medicine is warning Rhode Islanders about the increase in cases. This comes after Governor Raimondo announced we will remain in phase 3 for another month because the numbers don't support moving ahead just yet. Eyewitness News reporter Anita Buffoni joins us now with what that doctor had to say. Anita.
Well, putting it very bluntly, that doctor tells me Rhode Islanders should be very concerned with the rise of coronavirus cases the state is seeing since it entered into phase 3 of its reopening plan earlier this month. Now that Rhode Island is pressing the brakes when it comes to moving into the next phase of reopening, one top doctor in the state says that's the right decision to make.
I think we should be very concerned.
Earlier this week, the state reported 119 new COVID-19 cases. That's the highest number in a single day since the end of May. Many of the positive cases are being traced back to large birthday parties and barbecues, prompting Governor Gina Raimondo to reduce social gathering limits from 25 to 15, and also extending phase 3 for 30 more days.
We're partying too much. Social gatherings are too large, and folks aren't wearing their masks.
How we act at these sorts of events, what we do individually, is going to determine what we can do in the fall.
That may include a potential impact on the start of school when they reopen on August 31st. Dr. Scher says it will depend on how many cases there are in the community and the preparation schools can make in time. The growth in cases is nowhere near what other states are seeing to our west, but Dr. Scher warns if we don't get a handle on it now, the rise in cases could bring back harsher restrictions.
What we're seeing is the beginning of a bigger spread. And so if we can't keep it down to what it was before, we'll have to pull back even further.
And the bottom line, according to Dr. Scher, in order for us to return to some sense of normalcy, Rhode Islanders should stick to the guidelines, wash your hands, avoid large gatherings, and wear a face mask. In Providence, I'm Anita Buffoni, Eyewitness News.